Every 27 seconds, somebody in the world is being diagnosed with blood cancer. So just imagine the time that you take to brew a cup of coffee, somebody's world has turned upside down. Does that sound scary? But we'll break it up one by one to take you through the whole journey of blood cancer, how we diagnose and how do we treat it. What are the common red flags of diagnosing a blood cancer? We can remember it by a simple mnemonic, F blend. F is for fever, which is persisting for more than a week, not responding to common antibiotics. B is for bleeding from any side, be it the gums, your stool, urine, or bruises which appear on your skin, on the hands or legs, anywhere with minor trauma. L is for lymph nodes or swelling which appear commonly in the neck, the armpits and the groin. They may be painful but are usually painless and slowly growing in size. Next you have E. E is for extreme fatigue. Extreme fatigue is that accounts to so much that you are not able to complete your daily activities, and there may be weight loss accompanied with it, which is totally unintentional. N is for night sweats, which may require even a change of clothing, that it might have so much of sweating, it causes so much of sweating. Next is your D or decreased counts, which is a decrease in the total WBC count or in the platelet count or even in the hemoglobin. So if any of these symptoms are persisting or do not fit with the local symptoms that you are getting treated with your local physician, do consult a hematologist early. So when we think of a blood cancer, what are the tests that we can start with? Simple blood count or a CBC along with a peripheral blood smear is the most commonly done test. If we see any abnormality there, we usually urgently refer for a bone marrow examination. Now there are certain fear factors which are associated with a bone marrow examination, but here in a advanced hematology care unit like ours, usually these are not very much a factor. It's a relatively simple test which is done at the bedside, and with adequate anesthesia it is quite painless, and it can be even done as a daycare procedure, and the patient will be released at the end of the day. Blood cancers are easily treatable and some of them are even curable. However, a few of them may need to be treated with a stem cell transplant. Now, the amazing part about blood cancer treatment is that you carry the cells in your own body for somebody else's treatment. And what are these? These are the stem cells which are there, and you can be a donor for somebody else's life. A stem cell transplant is usually of two types. One is the autologous, where the patient is a donor for himself, and the other one is allogenic, where he needs to find a donor from somebody else. Now, finding a donor is like finding a needle in a haystack. Seriously, sometimes it's even worse or more difficult, and only 30% of these people or patients can find a donor among their own family, and the rest 70% they need to depend on the kindness of a stranger to find a donor. So on World Blood Cancer Day, this 28th of May, let's remember 3 points. Think early, test early, that's do a CBC at the earliest, and refer early, and also pledge to be a donor for a stem cell transplant, which will give you the chance to be a hero in somebody else's life.